Thank you, Mr. Chairman. As not a member of this committee, but I'm the sponsor of the House Bill 4392. I appreciate the chance to chat here a little bit with you. I think it's been enlightening to listen to some of the debate, some of the points, and it's where I wanted to make my remarks, and that was about the intent of this 26 years ago. And that was, the intent was to provide discounts of drugs to providers to, quote, reach more eligible patients and provide more comprehensive services. I think it's pretty basic. We have, just as for the record, we have 199 co-sponsors on our piece of legislation. That's more than any of the other pieces that have been debated here. We want to put a moratorium on that rule, because there are consequences for that rule as it goes forward with it. Because unless this rule is modified quickly, it's going to cut $1.6 billion from healthcare providers across America. And that there are going to be consequences. Hospitals and health systems are going to cut back on their services. We all see it, one of the hospitals in West Virginia, WVU Hospital. They use the facilities. I listen with interest all the way the program is being used, and I know at WVU, they use it to fund a bus that goes around to be able to do mobile mammograms throughout West Virginia. And the cancer rate in West Virginia is the highest in the country. And they're trying to reach that using the 340B program with it. But yet, WVU Hospital is going to lose $10 million through this if this program isn't modified. Now, I could go on with it, that a Kentucky hospital in Louisville with 9 hospitals is going to lose over $5 million. A clinic or a hospital in Cleveland is going to lose almost $7 million annually. And a large system in Greater Atlanta is going to lose over $5 million. I'm sure that we go on with example after example. There are consequences when we start reducing the funds from these hospitals. So I guess the question, Mr. Chairman, comes back is, has the mission of this program 25 years ago to, quote, reach more patients and provide comprehensive services, has it been accomplished? Can our healthcare system afford a nearly 30% reduction in healthcare funding and still survive? I think the answer is shouting. Of course it can't. And we have not achieved the mission. So our access to healthcare from both sides of the aisle, we have to have more increased healthcare access if we're going to take care of the folks in this country. So while we can continue to debate this rule or 340B program, but all the while, people aren't getting health care because of the $1.6 billion in cuts. So we can continue to debate this, but what we're trying to say, and I agree completely with Congressman Bouchon, is trying to reach the transparency. But I also say that the transparency is not only just for the providers, but it's also for the drug manufacturers. So what I'm hoping by issuing this legislation the way we did was to try to force everyone to come to the table, not just to debate forever, come to a conclusion. So, Mr. Chairman, I'm calling on you to keep the focus on this, please, that hospitals across this country, in West Virginia, $10 million, just one hospital.
Perhaps the gentleman would like to let the witnesses respond to his observations.
So I'm hoping that we can keep this focus, and I know I talked to the chairman about this. I feel we will, but the sooner we can come to a conclusion and something that can pass the House and pass the Senate, I hope we can do that. So I yield back the balance of my...
We don't have to yield back. We have 3 witnesses here who are experts. They may have opinions about what you've just said. You've got 42 seconds left. Dr. Cerise, do you have an answer or an observation?
So the change in Medicare reimbursement definitely has an impact on us, and I would suggest that there were concerns about the growth of the program or the oversight of the program, that we address it that way and not by a reduction in the Medicare reimbursement for eligible providers who are using those savings. We get $152 million in savings in the program. It's a significant impact for us to be able to take care. There are 1 million people in Dallas County who are either uninsured or on Medicaid, and those funds allow us to take care of that population.
Dr. Daniels?
The process of trying to restore the OPP reductions is very important to us at UC San Diego.
Thank you. Yield back balance.
Gentleman's time has expired.